Everyone, welcome back to the Trauma Recovery Coaching Summit, sponsored by the International Association of Trauma Recovery Coaching. I'm Bobby Parrish, the Executive Director of the association.
And hi, I'm Sarah Parrish, the Deputy Director.
We are so happy to have you here for 5 days of interviews with our coaches about topics ranging from trauma to trauma recovery coaching. I do want to issue a trigger warning. Some of the topics we talk about can be triggering, so make sure to use your best self-care skills while you're watching.
Thanks, Bobby. So today we have the absolute honour and pleasure in welcoming and interviewing Amber Day. Amber is here to talk to us about wellness strategies. Hi, Amber. How are you doing?
I am doing well. How are you, Sarah?
I'm doing really well. So it's an absolute pleasure to have you here with us today, Amber. One of your first questions you got for us is, what common problems do trauma survivors have?
Well, it changes a lot of things because we know that trauma even affects how our brain works. So relationships are hard. Our emotions are harder to manage. They get bigger. Anxiety and depression is very, very common. Avoiding people and avoiding situations because that's what hurt us. Trouble sleeping, trouble eating. So when we've had trauma, it really does affect almost every aspect of our lives, just because of all the changes that happen.
Yeah. So what are wellness strategies, Amber?
So wellness strategies are just some real basic things that we need to just be healthy. So getting enough sleep, which we know is naturally hard for trauma survivors. So trying to find a way to get at least 7 hours of sleep a night. Eating enough and not overeating, kind of managing your eating. Exercise is really important too. Exercise helps our brain process the trauma. It helps our bodies get all those happy chemicals. I attended a workshop with Charles Atkins, and he said that he specifically works with addicts, but he says if you've had some sort of trauma, that even an hour of exercise is kind of what your body needs to get better. And the hardest thing I think for trauma survivors is finding healthy connections, finding safe people that they can have those positive and healthy and safe social connections with. So those are kind of like the basic things, you know. I think sometimes we think, oh, get enough sleep, get enough eat, but even too, it's those relational things that are really important.
Absolutely, yeah. So wellness strategies, they are so important. Can you explain a little bit more to our listeners, to our viewers, the importance of it more, Amber?
Yes. So all of those wellness strategies, that's if we were completely healthy and we never experienced any sort of trauma, those would be very natural things that would happen. And those are things that our body needs. When we're sleeping, if we're getting an adequate amount of sleep, our brain's working while we're sleeping. It's kind of getting ready for the next day. It's cleaning out all of those things that were there from the previous day. And if you don't get enough sleep, you're going to be a little more on edge. You're not going to feel well. You're going to kind of have that brain fog. And that's really hard if you're already dealing with trauma and trying to, stay healthy day to day. Eating enough. A lot of our nervous system is in our stomach. So sometimes we underestimate the importance of just eating, not anything crazy, but just eating, an appropriate amount of food every day can really help. And if you're having a lot of nausea or stomach upset, like that can be hard, but our behaviors can be really affected by that if we're not eating enough. If our blood sugars are really high and our blood sugars are really low, or we're just really tired, or we don't feel good because we're eating too much, again, that just makes it harder when we're already trying to deal with this trauma that happened. And those things too, you know, if you think about it, if you were getting a good, you know, decent amount of sleep and doing all those basic things, you just have more life satisfaction. Just in general, those are things that just kind of a natural level of enjoyment for your life, which that would be my goal for any trauma survivor, is they get to that place where they just have some basic enjoyment again of their life, and that there's things that they look forward to, and they feel like they just have a basic handle on things that they can kind of get through each day.
Yeah. So what I'm hearing from you, Amber, I think, and I just want to clarify and want to get your input, is that all of these areas that you're talking about are interconnected.
Very
So
much.
if I don't sleep well, I struggle even more with my relationships. If I don't eat well, I struggle even more with my exercise. You know, that it's like a, I don't know, interconnected branches or something like that.
Yeah, it's kind of like, I'm trying to think here. There is a little bit of a balance to that, and they are connected. You can't really ignore one of those things because they do affect each other so much. Like even for myself, I know that if I don't get a good night's sleep, I'm going to be much more on edge. I'm not going to eat how I would normally eat in a day because it changes all of those things. So yes, there is a definite interconnected to this. But I think the other thing that's important about this too is all of those things are something that are within a person's control.
Yes.
So it gives some power back to the person, because those are all things. It might be really hard, because I know it's taken me probably a few years to really get a good sleeping routine in. I'm not saying it's easy, but you have the power to work on those things. You have the power to do those things. And I think that that's, I kind of forgot to say that, but I think that's what's important too. It doesn't depend on being able to get into an appointment with a doctor. It doesn't depend on your insurance approving a therapy or a medication. It's all something that you can choose to do each day. And I think that that's important too, because that gives some ownership and some power back.
Exactly. You know, and one of the things that we talk about as trauma recovery coaches is how important that relationship is between the coach and the client, and how much relationship skills suffer when we're traumatized. So what I'm hearing from you that I really want to call attention to is that my not getting the right amount of sleep can impact my relationship with my coach. My not eating well can impact my relationship with my partner. You know,
Right.
that there's a heavy connection between relationship and the wellness strategies.
Very much so. And I think you're right, again, that, you know, relationships are hard for trauma survivors because people are what hurt us.
Right.
And so as we're learning to have those healthier relationships, if we are doing those things, it's a little bit easier to have those harder conversations. It's a little bit easier to do something that's a little uncomfortable, like maybe, you know, even ask a friend to go out for coffee. Like maybe that's kind of an intimidating thing, or something that feels really scary. And if you had a decent breakfast and a good night's sleep, that might make it just be what you need to be able to make that step.
Yes.
Start building those relationships.
Yes. I love that. Okay, so what about medications? Because I know some of my clients, they take medications to help deal with sleep issues. What do you think about that?
I think it's completely appropriate. I think that there's a balance there, because medications are another tool. And sometimes those help people. And I think what doctors fail to mention is that medications don't always work as expected. Like depression medications have like something like a 25% effectiveness rate. Like it takes some time to find the right one.
Yeah.
So I think that obviously that's a doctor level issue. That's not something a coach can advise in. But if people know that, first of all, it's completely okay and it's completely appropriate if you need to take medication for whatever it is, you know, whether it's sleeping, whether it's depression, but to also have it in their mind that it's okay if it doesn't work, and it's okay if they need to try some other things, and it's okay if they need to go back to their doctor. a few times to figure out something that works. And I think too, the nice thing about, like, you know, those very simple wellness strategies, it's not going to interfere with your medication. If anything, it's going to help support that and maybe even make them work a little bit better, you know, if you're doing those things. So I just think that's what's so important to remember is I at least in my experience, I know some people just get so frustrated because they are really struggling. They reach out to their doctor, they get a medication, and then it takes some time. It takes a few different options until they find something that really helps them feel better. So I feel like that's an important thing for people to know, that that's normal and that's okay, and to just keep asking for doctors if it's not quite helping like they expected.
Yeah. So do you have a lot of clients who struggle with that decision to take medication because they feel like they should be able to do it all themselves?
I don't know that that's the resistance that I find. Probably the bigger issue is sometimes even accessing medical care.
Okay.
And sometimes even having that conversation with their doctor is a little bit challenging. Not so much the medication itself, but access to getting that care is sometimes harder. And probably concerns about side effects, if I had to think about objections that people have. And I think we just all work with different populations of people. I know that for myself, medications, I have a genetic condition, so medications often won't work at all. So I have to be really creative. And that's another reason why I think these strategies are important, because it's one more way to support yourself while you're getting the medication you need if you need a medication. And to do those in combination.
Yeah.
It's a hard thing. It's one of those other very hard things to sort out sometimes.
Yes.
Yeah, absolutely. I don't think, I think we have to remember, that we've got to take this as a very much of a holistic kind of approach sort of thing. One thing's not going to fix everything. We're going to need so many things in place, to help us, But if people are struggling, Amber, what should people do, to reach out to a medical provider and things like that?
I think always, safety is first. If you're really struggling to the point where there's some thoughts of self-harm, like, I would strongly encourage you to find like an emergency line in your area. And if it's more of a day-to-day thing, like you're just not getting enough sleep, maybe you have a lot of anxiety, maybe it's difficult to do those things, if you're not able to eat enough or eating too much, like, those are good guidelines. If you're not able to if you're struggling to do those really basic things, that's a good sign that a conversation with your medical provider is a good idea. And I think, like Bobby said too, I think it's a good point that sometimes coaches can help plan out that conversation a little bit too, and talk about what that might look like and how to explain that to the doctor. Because I think the other side of it too, when you have a history of trauma, I think it's important that the doctors know that. The doctors may need a little educational piece that because of like the neurological changes, sometimes a medication may not work, and that's why, especially the symptoms of ADHD can look a lot like that trauma, that hypervigilance, that not being able to sit still. So if it's trauma and it's not what would typically be treated, then it might not be a good match. So I think it's just having that ongoing conversation about where you're at, what's going on specifically. I know doctors are super busy, and it feels a little unfair that patients have to do some prep work sometimes, but if you can keep some sort of note, like Monday I only slept for 5 hours, Tuesday I got up 6 times, this is what I ate. Sometimes when a doctor sees that on paper and you've got the record, they'll take you just a little more seriously And they're going to have a little more information on how frequently that's happening, and sometimes those patterns can help find out if it's, you know, maybe you fall asleep but you don't stay asleep, so maybe that's a different medication, you know. So that's just an ongoing conversation to figure out. Sure.
Yes. I love this, Amber, and I love the way you truly provide that all-around holistic support for your clients and help them also, you know, prepare for other tough conversations they might need to have about their health. If someone is watching this interview and they're like, oh my gosh, I love her, how do I find her?
Probably Facebook is the best way to reach me right now. My business page is Northern Lights Trauma Recovery. You can message me there. You can find me there. I have a self-care worksheet I'll be happy to send over to you if you want to reach me there. I can provide that to you, and that's just a walkthrough really of what we talked about today, to check in with yourself and just see kind of where you're at. Sometimes on paper that helps to look at it differently.
Yes, yes. I love that because it's so empowering, like you said earlier. So thank you so much, Amber, for being here today and for sharing the information that you have.
And thank you. Thank you for this opportunity.
Thank you, Amber. And I just want to say thank you to everybody who has come along and listened to Amber's interview today about wellness strategies. We hope that you are all enjoying the rest of the summit. There are still plenty of more videos for you to watch. But until then, we hope that you all take care, and we hope to see you all again soon. Until then, bye everybody.
Bye.